there's been a lot of comments like this asking about mom being over medicated, and just to kind of lay out the timeline, nothing had changed with mom, and she was acting very different, very altered, babbling, incoherent before any medicine changes were made last week. Normal suspect when that happens is a UTI, but she was on medicine for that already, and that was not the case. She was raspy in the lungs and was having a decreased O2, which led us to believe maybe a respiratory infection. So typically it's a UTI, urinary tract infection, that causes that behavior. This was maybe a different infection. So that's what prompted us to call hospice. We are aware that hospice hospice is wonderful, but also can over-medicate. So we're continuing to be the best advocate for my mom that we can be. So the only medicine that was switched out was an antibiotic was added, which was amoxicillin. Nothing very different there. And then changing out Xanax for Ativan. And we were already seeing the lethargic babbling prior to any medicine changes. But of course, with the medicine changes, we are seeing more of that. So we're kind of, it's a every 4 hours or as needed situation. So we're pulling back on that a little bit just to kind of see. She did really well on it the first day. She was like waving at herself in the mirror again and asking my dad to give her a kiss goodnight, stuff that she normally hadn't been doing. So we thought this medicine maybe is a better anxiety situation to calm her down. Her O2 has continued to be up and down, everything from in the 70s to back up to 98. Yesterday she was 77. Today she was 98. So obviously the lethargicness and cloudiness and babbling gets worse when there's not as much oxygen going to the brain. So we're aware and making sure that we don't over medicate. As Dina says, she's our aide during the week. You know, it's easy to take care of someone who's asleep 24/7, and we don't want that. If she's not suffering or in any pain, we don't want that. So we're looking to find that balance. It also may take time to adjust to new medicines. So we're analyzing that and continuing to look at what is needed and what's not. And we'll do as little as we need to as far as medicines, because we don't want her just sleeping all day if she doesn't need to be. So thank you for the comment.